Welcome. Let everybody get a chance to come into the room. There we go. I just have to sit back a little bit. Oh, how sweet. We're so cute. Hey there. Let's see. Bye, Patty. Hopefully we get people coming in here. Excuse me. Hey, everybody. Sorry for the noise. Hopefully you can hear us. My name is Megan, also known as Mistress Christmas. And today we are going to do a quick Q&A with Jay Weissman. We are here at the end of the Society of Janus Munch, which happens once a month. And since I have a captive person here, I thought we would take advantage of it. So this might be a rather short Q&A, but it is what it is. So anyways, I guess I should say I've been in the BDSM community for about 27 years. I'm primarily Dom, though I am a switch, occasionally submissive when I can. And Jay here is the author of the book SM 101, which is the standard for BDSM. So let's go. Anybody have any questions that they would like to ask? Or actually, why don't you tell us a little bit about yourself real quick?
Well, let's see. I've been in the community since 1975. I've written 13 books, 6 of which are currently in print. I've done 5 instructional videos, 4 of them on rope bondage techniques. I'm a multi-state court-qualified expert witness on BDSM in general and on erotic asphyxiation in particular. I've taught many classes over the years. 2014, Society of Janus selected me to their Hall of Fame.
Hall of Fame?
Yes. About every 5 years, they induct people into their Hall of Fame.
Can you guys not hear us? Can you hear us okay? Periscope's been having problems lately.
We're getting
Somebody indicate you can hear us. Perfect?
Okay.
All right, good. Sorry.
Anyhow, so they inducted me into their Hall of Fame. In 2007, Black Rose gave me their Vaughn Keith National BDSM Educator of the Year Award.
What's Black Rose?
Black Rose is a major club in the Washington, D.C. area.
Oh, cool.
Yeah, it was a great honor.
Excellent. So, anybody have a question that they would like to ask Jay? Come on. I don't know why we only have so few people. This is really weird.
Oh, well, we'll pick it up later.
Can Jay talk about dungeon emergencies and supplies a bit?
Yes.
What are the essentials?
I was an ambulance crewman for a long time. I was a firefighter for a while, and I've been a first aid and CPR instructor since the early 70s.
Right.
And at my publisher's suggestion, I wrote a book called Dungeon Emergencies and Supplies, which Crack.com called the 6th scariest sex education title ever written. And
really?
Yes.
Scary. Cool.
And I teach a fair number of first aid and CPR classes in the BDSM community. I taught one a couple months ago. And I'll be teaching several of them in 2016. And basically, in Dungeon Emergencies, we talked about things that could happen during SM play or possibly just being in the community. There are medical emergencies like a heart attack or a laceration or a burn. There are environmental emergencies like a fire or an earthquake.
Correct.
And then there are behavioral emergencies like an assault or a suicide attempt or something like that.
Right.
And so and then there are some emergencies that are unique to BDSM. For example, what if your lock jams shut? Or something like that. And so we picked 30 of these emergencies and wrote a brief description about how to cope with them.
Cool. Can you give us some examples?
Well, for example, if you think that somebody is having a heart attack while you're playing, they're still breathing, they're still conscious, but they may have, chest pain, and they may be pale and sweaty and having difficulty breathing, and it's important to recognize that for the urgent situation it is. Generally, the patients do well if you put them at rest in a sitting position. Nowadays, you might want to give them some aspirin to chew on. And one of the major things about somebody with chest pain is that you don't want to take these patients to the hospital by private car, if at all possible. If they suffer a cardiac arrest in the car, obviously that's a very bad situation. So you have the person at rest and you call the ambulance into them. Chest pain patients go to the hospital by ambulance. It's very unwise to transport a chest pain patient by private car.
Somebody asked about suicide during play. Does that ever... that seems like that would be rather unlikely, but I suppose.
I don't think I've ever heard of anybody actually trying to kill themselves during S&M play per se, but we're human beings, and human beings have problems from time to time. As much as I like to tell anecdotes and so forth, I don't like the fact that I can say that I personally knew we live in San Francisco, and I personally knew two BDSM community members who jumped off the Golden Gate Bridge.
Oh, wow.
Yeah, very. That kind of makes it personal. I knew these people. I wasn't super close to them, but I did know them.
Yeah, it does make it personal.
And it's important to recognize the signs of it. Are they vocalizing this? In particular, have they created a plan?
Yeah, was there any kind of warning about this beforehand? I mean, did you know, you could see it coming kind of thing? Or
in one case, there was. In one case, the person got, if memory serves, taken in on an involuntary psychiatric hold a couple of times and and released, and finally he went off the bridge.
Right.
The other one, I wasn't quite as close to that guy as I was to the first guy, so I was very shocked when I heard that the second guy had committed suicide. I knew he had some business problems and quite probably some health problems as well, but he hung out in a slightly different crowd than I normally did. So.
Right. So what other kind of emergencies then, like from your book?
Well, probably the BDSM emergency that happens most often during playing, or certainly one of the most common ones, is somebody faints. Somebody loses consciousness.
Yes, I've had that happen.
And one of the things to understand about fainting is that fainting is a symptom. It has dozens of underlying causes, most of which are relatively benign, but some of which can be quite ominous.
Downright serious.
On my FetLife group, I have a sticky, an essay I wrote some time ago called Assessment and Treatment of Fainting in a BDSM context.
Right.
And how by assessing the patient, you can determine, ambulance crews are sometimes taught that patients fall into one of two categories. There's big sick and there's little sick. And so you want to try to find out fairly quickly, is this a big sick patient or is this a little sick patient? Like, for example, fainting in somebody older than 40 years old would be somewhat ominous. If a person faints while they're in a standing position, that's not as ominous as if they fainted while they were sitting down or they were walking or lying down or something like that. So, did they have any warning signs that this was going to happen? Were they starting to develop a cold sweat? Were they starting to feel dizzy or nauseated? Was their vision starting to gray out at the edges, or just did it hit all of a sudden? In the older people, in the more sudden onsets, that suggests a cardiac arrhythmia of some sort, whereas the others would suggest a more neurogenic type of thing. Most of the time, people recover from their fainting relatively well, but every now and then, fainting is a real warning sign. And one of the ways it comes up in BDSM play is if you're going to tie somebody into a given position, you should ask yourself, what if they faint? If they go unconscious in the position they're in right now, can I get them down onto the floor on their back
Right.
relatively easily?
Yeah.
So if you're...
In the case of suspension, this is quite difficult at times.
It is, and people who are skilled in suspension will actually do dress rehearsals and drills
Right.
as to how they would get the person down. But if you've got somebody, tied to a St. Andrew's cross, or maybe even on a bed or something like that,
Yes.
how can I get them from where they are in a controlled way to a face-up position on the floor?
Right.
And if you don't think you can do that with the resources you have, if you're a little bitty dom and you've got a great big sub,
That is true.
maybe you shouldn't tie them into a position where you can't get them onto the floor if something happens.
Yes, exactly.
We've had some pretty bad case reports on that, actually.
Yeah. So, any other questions, people? Speak up now. Let's see here. There was something I was going to ask about. Oh, yeah. We're going to do this a class tomorrow on dungeon monitoring.
Yes.
Well, can you tell people a little bit about dungeon monitoring? Because probably most people aren't aware of this particular subject. Most people just play. They're and often not playing in public.
I remember when the concept of the dungeon monitor first came around. Of course, we'd been having play parties for quite some time prior to that. And usually there was some particular person who was in overall charge of making sure that the party was going smoothly and people were behaving themselves and so forth. The dungeon monitors were originally brought in to make sure that venues that had safer sex rules, that the safer sex rules were being complied with.
Right.
And that concept has expanded a little bit now. Hopefully dungeon monitors are reasonably experienced about evaluating various types of play, making sure the party rules are being complied with and so forth. I actually wrote an essay back in the mid-90s called 10 Tips for New Dungeon Monitors, and I believe that's a sticky on my FetLife group. It's
Right.
been used in many dungeon monitor training programs. I was actually a charter member of the board of directors of the Bay Area Dungeon Monitors Association.
Oh, very cool.
Yes.
Somebody asked if you'd ever done any consulting for movies. I mean, I've done a ton of documentaries, like, HBO Real Sex and on and on and on, but...
I've been in a couple of documentaries.
Yeah, it's like we're in them more than we're asked to help about them, so you've never... I've never.
I've never been, like, I think... I've never been like a bondage technical consultant.
Certainly not 50 Shades of Grey.
Yeah. No,
obviously, if we had been consulted about 50 Shades of Grey, it would have been a very different movie. In fact, it wouldn't have been anything like the book, because the book is nothing like BDSM at all. So,
one interesting thing about that book is in 50 Shades of Grey, there's something of a negotiation checklist, and there were some people who said to me that they thought it was a little bit similar to the negotiation checklist in my book SM 101.
Yeah.
So I don't really know how accurate that is, but
I've seen the movie. I've read all 3 books. They were really hard to read because they're so poorly written. But there's a very small little section about negotiation in the books, mainly in the first book, and it sort of follows your Not really. It was. It
Well, it
just
started out as fanfic, for crying out loud.
yeah.
You know?
50 Shades is just a disaster relative to real world, but
Well, it caused a spike in the sale of BDSM nonfiction books.
oh, cool.
Yeah,
Well,
so a number of the authors who wrote pretty clueful how to do BDSM books experienced a rise in their sales behind that. We can do like probably one more question and then we probably should go.
all right. Yeah, Jay has to run here. So, any last questions? Or we will cut this short today. And I may do a toy scope either later today or tomorrow, but that is up in the air. No more questions coming. All right, people. We are going to cut this off now. So thank
Nice to
you
see you.
all
Take
for
care.
coming.